And now, after finishing the introduction, our first studied disorder will be congenital hypothyroidism. It's present in 1 in 3,500 births in the UK. Babies having this disorder look and behave normally at birth, so screening program is needed for the recognition. If left untreated, children develop irreversible mental retardation and characteristic features of cretinism as in figure 3. Here is what is happening at the biochemical stage. At the left, the normal situation where the anterior pituitary excrete thyroid stimulating hormone TSH, which obviously stimulates thyroid to function. By that, thyroid excrete T4, which is a negative feedback regulator, so it balances the secretion of TSH. In the case of congenital hypothyroidism, there is thyroid dysgenesis that has developed in the embryonic growth. This caused the inability to intake TSH by thyroid as the normal amount, and also the inability to secrete the regulator T4 by thyroid itself. And this induced the pituitary to secrete much more TSH than is needed in the body. So more TSH is present in the blood, and this what is being used as a diagnostic tool for the disorder. Thyroxine treatment should be initiated as soon as possible after the positive diagnosis of the disorder. The treatment dosages range between 10 grams per kilogram at birth to 100 to 200 grams per day by 12 years. The adequacy of the treatment is obtained by the normal level of both TSH and T4 in the serum, and also the absence of clinical signs of hypothyroidism and hyperthyroidism. In rare cases, the thyroid is normal, but maternal autoantibodies cross the placenta and block receptor site on fetal thyroid. So there will be a transient hypothyroidism just after birth, but thyroid usually develop normally. So when the first positive result is present, mother's thyroid should be assessed to make sure if the disorder is just transient or permanent. Note that the TSH screening is not used to diagnose secondary hypothyroidism that happens due to pituitary disease. Here we get to the second question, which is a case. Try to choose the right answer below before the video ends. The case is 2 TSH estimation tests is done on a 6-day-old baby girl. The first was 28 millunit per liter and the second was 6 millunit per liter. What further actions should be done on this case?